Hi, everyone. I'm so excited to have Nicolle Kasch here today with me. She is the owner and founder of Mind, Body, Baby. She's a hypnobirthing educator for fertility and birth doula and a certified hypnotherapist. She offers group hypnobirthing classes and birth doula support, as well as community workshops, support circles, and doula matching. Her background is in sociology and child development, and she has additional education, including hypnobirthing, Kappa labor doula, certified fertility support specialist, and she's also a certified transpersonal hypnotherapist as well. Mind Body Baby is a special team of perinatal professionals who work together to support individual families as well as our community. And Nicolle's vision for Mind Body Baby is to create a community where families can be wrapped in loving support wherever they are in their journey to build a family. So, welcome, Nicolle. Thank you again for joining us. And I would love for you to tell us a little bit more about yourself and Mind Body Baby.
Yeah, well, thank you so much for having me on. I am extremely passionate about this, as you know, and could talk about it endlessly. My journey began when I was pregnant with my first child he's about to be 11. So, what is that, 2013? He was born. And at that time, much like most ignorant first time moms, I didn't know much and was definitely terrified of the process. So I figured the best thing to do was to get educated and take as many classes as I could through the hospital. But in doing so, I realized that their birth preparation, or what do they call it? Prepared childbirth, left much to be desired and actually ended up making me feel more terrified than reassured and prepared as it said it was going to. So I ended up finding the Hypnobirthing book by Marie Mongan at a local bookstore and was hooked immediately. As soon as I opened that book, it felt like it was really speaking to what I knew intuitively that birth could be. The hospital painted it as this procedure, this clinical procedure where you're going to be hooked up and the baby will be extracted from you and, it'll all be managed for you. And to me, that didn't feel like a very connected experience or sacred experience. And in my heart, I knew that welcoming a child into the world could be more than that. That's exactly what hypnobirthing gave to me. And I went on to have a really, really positive experience with him. I ended up not needing any pain medication. We had zero complications. And after that, I just couldn't shut up about it. I remember I was one of the first of my friends to have kids. So I would tell everybody, they would want to know, how did it go? Did you get an epidural? And I would say, no, it went great. And they couldn't believe it. I also hired a doula to support me, which was really, really helpful as well. And so in the, months following his birth, I just started to realize I was becoming even more interested in birth physiology and even like I was really curious about our like rights in maternity care too, about like what we're, quote unquote allowed to do, and found that really fascinating. I was still working in the apparel industry at the time at a corporate job and figured I couldn't do birth doula work quite yet because being on call is hard. And so I started teaching hypnobirthing in 2014 and have been doing it ever since. I am particularly passionate about the hypnobirthing philosophy. It kind of is the root of everything else that I do because with this method, we are looking at birth as an opportunity for transformation. We also are centering the baby's experience because, we often forget that the babies are conscious beings coming into the world and they deserve to be treated with respect and to be given a gentle entrance because it kind of shapes who we are. And, imagine a world where all people came into the world gently and calmly and full of love instead of trauma and things like that. So that really informs kind of everything else that I do. Um, so yeah, I've taught, I think over, gosh, maybe like 800 families in Orange County and also other parts of the country, thanks to Zoom and the pandemic, I guess.
That's amazing.
Yeah. So that was kind of cool to be able to reach more people outside of our little bubble here in Orange County. Um, and then I became a birth doula when I was pregnant with my second in 2015. I went on to have a home birth with him, which was far and away the most incredible thing I've ever done in my life. It was such a joyful and ecstatic experience. And I joke that I would do it every month if I could, but I don't want that many kids. We're good with the two. So that kind of just again confirmed everything that I knew to be true, and was such a great experience. But after his birth, I quit corporate life and became a birth worker and stay at home mom full time, and got into doula work more heavily. And yeah, that's like mostly what I've been doing all these years. I started to get interested in fertility doula work as well, as my best friend struggled with infertility in her, let's see, how old are those boys? I think she was in her like mid 20s. So she was pretty young, and they were struggling with infertility. So they did IVF, and it was an eye opening experience supporting her through that and seeing how challenging that process was, and also how emotionally difficult it was for her. And that sort of inspired me to get into fertility doula work a little more. And then, yeah, I became a hypnotherapist, but I don't really do much clinical work. It's mostly to support my students and clients, pregnancy and birth and postpartum. But that was also really great in deepening my understanding of the subconscious mind and creating change and things like that. So it's been a great journey.
Well, your passion for what you do is really inspiring, Nicolle. So I love meeting practitioners like yourself. And I needed you probably 22 years ago when I
I
had my
know.
first son.
Everyone always says
But
that.
yes, and I will say I had to do over my second birth, which has made me very passionate about the work that you do, and being able to have choices as a mom that's about to deliver. I think, as a first time mom, like you said, I was very naive, and there was, a lot of fear around it. And so you kind of followed a lot of the traditional model that's presented in front of you. But I think after I had sort of more of a typical hospital birth, I knew the second time I was going to do it differently. So being able to have a natural birth with a midwife completely changed my life. So it's
Yeah.
very near and dear to my heart for patients to have the opportunity to have a natural birth if that's what they seek. And, working with doulas like yourself to be able to provide the support that they need has been really incredible. And so I'm just like, fast forward 20 years, the resources available now compared to what was available back when I was having my kids is like a 360 turn on the
Yeah.
difference now. So I'm just super
Even just
excited for
like,
my patients.
yeah, even 10 years ago, it was so different. There's so many more resources now. So it's amazing. I'm so glad that we keep moving forward with resources and also awareness. I think of different things. Like I remember when we first started, nobody knew what pelvic floor PT was. And now like half
Mhm.
of my students and clients are already working with them. Or people didn't really know what acupuncture, like how acupuncture could really help with pregnancy, um, or like preparing for labor. And now it's like widely known. So it's really great.
Yes, and we're excited to be able to provide these services and integrate and collaborate and treat with practitioners like yourself. So I know you were mentioning earlier about your hypnobirthing classes. Just curious, are you still doing them online or are they primarily in person now that COVID is kind of
So
behind us?
Yeah. Um, so right now I teach in person, but I always have a virtual option. So I have a camera set up in the space where people can attend virtually kind of from wherever. And they're kind of sitting in our in-person class, but they can participate fully. I can see them on the screen. Everybody introduces themselves. They can speak and everyone can hear them. So it's kind of a nice little hybrid option for
Hmm.
people. Like right now, I have a virtual student. Where is she? She's like on the border of LA. So it's just a little too far to drive down to Laguna Hills, but, still wants to be able to participate and be kind of in the same community. But I've also had people on the East Coast and in Oregon, and I'm trying to think of all the different places. It's been in like the Bay Area. So yeah, so I have both.
That's great. And Zoom has opened up that option for us, which I think is perfect for patients that maybe they don't have resources around them and they're looking and
Yeah.
they're searching for, folks like yourself. So it gives them that option to get the education that they need to prepare them for their birth.
Yeah.
So I was just curious, what type of patient do you most enjoy working with? Because it sounds like you have a broad spectrum of things you work with between birthing, as well as being a fertility doula too. So I'm just curious.
Yeah. I'm still finding my way with fertility clients, so I haven't built that up too much yet. So I would say I'm primarily working with people who are already pregnant and want support throughout pregnancy and birth. I also don't tend to do a lot of postpartum work. I don't know why. It's just, you have your wheelhouse, I guess, and mine just happens to
Mhm.
be pregnancy and birth. And then I kind of pass them off to somebody else for postpartum. But that's what's really great about the community is there's so many wonderful postpartum doulas that I work with that we can kind of do that handoff and still stay connected. And I, tend to keep in touch with my clients for many years, which is great. Yeah, I would say mostly pregnant people, pregnant families.
I love that you have this collective too. And tell us a little bit about the collective that you have of the doulas that you work with. And it sounds like everyone kind of has their own specialty and they have their own
Yeah,
gifts that they bring to the table.
yeah. So of course I can't do it all. So it's really important to have a collective of like-minded professionals. And so that includes, other birth doulas, say I can't take a client because I'm full or maybe I'm too expensive. Doulas come in all shapes, sizes, and budgets. And something I've always been really passionate about is making sure that any family that wants a doula can have a doula. And we are so fortunate that there are a lot of doulas in the community with varying experience levels and it can charge different rates. Some doulas also offer sliding scale. We also have doulas who take Medi-Cal. So I will help match families with birth doulas or postpartum doulas that fit their needs and their budget so that everybody gets the support they need. So yeah, there's some of the doulas are postpartum as well. Some of them offer other services like massage therapy, placenta encapsulation, all sorts of different steps. So it's kind of nice to just be able to work together to support families.
That's awesome. Sounds like you have quite a collective. And I love that you're able to match your clients too with the right fit. And I was reading about that on your website about like the sliding scale and Medi-Cal. I didn't even know that
Yeah.
doula services could be covered.
Yep.
So I learned a lot just by reading your website and learning more about, doula services and how it could be available to everyone.
Yeah.
So yeah, and so just out of curiosity too, in terms of your collective, how many doulas are within your collective, and what
Um,
areas do they cover, or what's the region that you guys span
Yeah,
coverage
it kind
for?
of it varies because like I don't know, it's always kind of not like always a rotating door, but it kind of just depends on who's around. Like some people move, some people get pregnant.
Mhm.
So it kind of just depends. But it's pretty much just Orange County. I don't have anybody in LA, but I do have doulas that will go all the way up to like the Long Beach area, if needed.
Mhm.
And then of course all the way down to South Orange County, up to the San Diego border, probably. So mostly Orange County proper, though.
Okay. Well, that's still nice though to have that option of like North San Diego,
Yeah,
Long Beach. That gives you a
yeah,
little
yeah,
bit
yeah.
more
And then
coverage.
some of them will even also go out to like the Inland Empire area, like more central. It kind of just depends on where the doula lives.
Yeah, I would imagine that there's probably limited services out in certain
Yes,
counties.
yes.
So yeah, that's great. As far as timing, this is a question that I get a lot, is when is a good time for patients to find you or start the interviewing process for a birth doula?
Mm. As early as possible. I have been the first to know when somebody got pregnant before they even told their partner because they wanted to
Wow.
make sure I would be available. So, yeah, the thing about hiring a birth doula is the minute you have them, the support starts. So you really get more bang for your buck the earlier you hire a doula. Another
Mhm.
reason why I got trained as a fertility doula too is so that I could help with that transition for people who are going through fertility services or like IVF, and they're wondering kind of when to switch over into like, after what is it, like 12 weeks, you just get to be a normal pregnant person. But before that, you're still kind of like, I don't know. So it's kind of nice to be able to even offer support maybe as needed in the beginning until we can formally sign on for full like birth doula support later. But yeah, it's literally never too early, except for maybe like, before you're even thinking about being pregnant.
Okay, got it. That's very helpful. And when is sort of like the last or the kind of cutoff time frame to hire a birth doula?
So again, I've been hired at like 37 weeks, although I
Wow.
will say you you always benefit from having continuous labor support from an expert like a doula. So there's really never a time where it's too late. There are some hospitals that have volunteer doula programs. I don't think there's any in Orange County right now, but I know San Diego has one. And so basically, what happens is you show up and they have a doula come in and support you. So you would have never met that doula previously, but you still get the support for labor. So even that is really beneficial, although I definitely would not recommend waiting very long, because one of the other things that's really great about having a doula is it's somebody who you've maybe created a little bit of a relationship with prior. You've talked in depth about your hopes and dreams for how labor goes. She's gotten to know you better with, how you like to be spoken to, how you like to be comforted, how you like to be touched. Um, Also, sometimes it's really helpful for us to know like trauma histories, because those are things that can come up during labor. And so we can be more understanding in the moment if we're kind of have that background information. And also just the fact that you get to know a doula so that it's not another stranger in the room when you're giving birth. I mean, in the hospital setting, you're surrounded by strangers. So to have another familiar face that's on your team is incredibly valuable. But yeah,
Mhm.
never really too late either.
Well, that's good. That's good to know. I'll try not to send our patients at 37 weeks to
Yeah.
find you and your collective.
Luckily you get them early.
I do. And I think that we can do a lot of work together in that fertility doula space and helping with that transition, especially since our practice is probably like 80% fertility and a lot of our patients are going through treatments. So
Mm-hmm.
usually they're graduating from their reproductive endocrinologist around 10 to 12 weeks. So
Yep.
that's, and I think most patients are hesitant and a little scared and fearful to actually like admit, like, okay, I'm like really pregnant now and this is a viable pregnancy.
Yeah.
And I think I'm actually now ready to hire someone. So I think having sort of that in between time
Mm-hmm.
frame and support from someone like yourself is great because,
Yeah.
and I'm sure you've met women like that where until they're
Yes.
way further into their second trimester, they don't actually want to fully embrace like, okay, this is a viable pregnancy, especially when they have a history of recurrent loss,
Yes.
and potentially second trimester loss. So I can see where some women will push out hiring a doula, a birth
Mm-hmm.
doula, for a while.
Yeah.
So, but I love that you're offering sort of this this I'm going to call it filling in the gap service
Yes.
of, I'm ready to hire you as my birth doula, but not yet. I just graduated from my RE, and what do we do in between? And so being
Yeah.
able to give them that encouragement that it's okay to embrace this pregnancy and to release some of the fear and anxiety around it. So tell me a little bit more about the hypnobirthing classes. So when do those classes start? How long are they for? I know it's a series. I believe it's 6 or 8 weeks, something like
It's
that,
less
right?
less than that. So
Less than
yes,
that.
it
Okay.
is a comprehensive birth class, which means that they don't need to take another birth class. Like they wouldn't need to take the hospital birth class unless they really wanted to, but I always warn them it's going to be a very different experience than what the hypnobirthing class has to offer. But typically it's a 5 week series. I'm playing with condensing it down to a 4 week series just because people are so busy that it's really hard to commit to, several weeks in a row. And I'm finding that people just get busier and busier as the years go on. So,
Mm-hmm.
4 to 5 weeks. And, the name hypnobirthing is a combination of hypnosis and childbirth. And that is one aspect of it. But I feel like the name does the method a disservice because it's really so much more than that. I originally trained with the Mongan method, which is the original hypnobirthing method developed by Marie Mongan in the 80s. So it's been around for a very, very long time. But I felt frustrated with how that organization wasn't staying really up to date with what parents and families truly needed. And so a few years ago, after I was trained as a hypnotherapist, I decided to create my own program um, because I wanted to make sure that families were leaving feeling prepared in every way that they could. So a lot of what hypnobirthing is relaxation and breathing and mindset work, affirmations, visualization, and then the hypnosis audio tracks that they listen to every single day. That's what I call like the yummy toolkit. Like that's the stuff everybody like really loves, right? Because it's just so nice and relaxing, and it's really beneficial for pregnancy, regardless of how labor ends up. But there's studies that show regular relaxation practice in pregnancy actually has better outcomes for babies. So they found that the babies were born more healthy in the sense that they had higher birth weights, like healthier birth weights, fewer premature births. They were more sociable. So they were able to recognize their parents more easily, more calm, things like that. So the practice alone is majorly helpful. And we also go over all of the like standard birth class stuff, like how does the uterus work? What are labor hormones? The labor process itself, what does that look like? Labor positions. They're group classes, so partners usually come to, and we'll do position work together. We'll show them physical comfort measures, counter pressure, massage, different types of relaxing touch techniques. And that stuff's all really fun. But something else that I'm also very passionate about and why I kind of needed my own program was because I wanted to make sure families knew their rights and how to advocate for themselves, especially because most people are giving birth in a hospital. And most people that come my way are hoping for a lower intervention birth. I would say most of them maybe have a goal to be unmedicated, and some of them don't, but really most of them want autonomy. They want to have a positive experience where they feel not in control necessarily, but maybe they don't want to feel like they're having something done to them that they don't want to do. They want to be informed about the process. So we also go over, how to create a birth plan, the different options for that, understanding, the way hospitals work and how hospital policies work, and some of the challenges that they may face when wanting to achieve a goal of having less intervention in a location that's all about high intervention, while still keeping them and their babies safe. So I feel like it's been really successful marrying those two sides of it. The partners especially love all of the discussion about informed decision making and advocacy. I think it really inspires their protective nature. So it's kind of nice because the moms feel like, okay, great. All I have to do is breathe and relax. And then the partners are like, great, I'm going to not let anybody do anything that we don't want them to do. And they feel more confident going into that space. And I feel like the stories that I hear from students are wonderful. They are very diverse in what ends up happening regardless of the plan. But what I love hearing is, nothing went to plan, but we still feel so great about it because we really knew how to ask good questions and we really understood everything that was going on. And it really did feel like my choice all the way. And I'm so grateful for that. Of course, I do love it when people say everything went exactly how I planned it. And that's great too. But I want there to be both because we can't control every aspect of it.
I love this. It's so needed. And I think it's true to have the partners feel more involved, and
Yeah.
especially if couples have gone through IVF treatments or some type of ART, I feel like the guys can feel like, where's my part? How can I contribute? So
Mm-hmm.
it really allows them to kind of take a active role and be, more involved in the birthing process and the decision-making process. And it is nice for the mom to be able to relax and kind of
Yes.
just say, okay, you got this. And let me
Yep.
just focus on keeping my peace, being pain-free and keep myself centered for the birthing process. So, but that sounds incredible. So 4 weeks, and are your clients usually coming in at various times of pregnancy, or is there a certain time frame that most people sign up by?
So I prefer if people sign up between like 20 and 25 weeks of pregnancy, which is unusual. Most people think that, you take a birth class in the third trimester, like at the end of your
Mm-hmm.
pregnancy, which I would say is true for the standard birth classes where you're just kind of learning a bunch of information that you have to remember. But the way hypnobirthing works is we're not really teaching people how to birth. If anything, we're trying to help them unlearn all of the myths and scary things that they've been told their whole lives about what birth can be like. Most of the information and the visuals that we have about birth are from TV and movies, which are not at all accurate. And then if you think about the birth stories people tell, it's usually just doom and gloom and terrifying and traumatic. And so I have to come in and try to undo all that damage, and that takes time. What's nice about hypnosis is it is a bit of a shortcut in that sense. However, it does require time. Hypnosis work and hypnotherapy works best when it's repeated. So we say that, you have to like listen to a hypnosis track for 30 days straight before we can say that it's creating change in the subconscious. And so that's why it's good for people to start earlier in their pregnancy. because we need to start that conditioning, that reprogramming of the subconscious earlier, because we don't have as much time at the end. And so we can't do as much necessarily. Um, and also, what I think is nice about starting it a little bit earlier is because of we talk about different options for birth and options for care providers and birthing environments. I think it's something people don't really think about too much. But then when we discuss, oh, you would like an unmedicated birth? Well, have you ever considered working with a midwife who's an expert in physiologic birth? And there's different options for midwives. There's home birth, birth centers, hospitals, and people don't really know about this. So when I tell them at 5 weeks that this is an option, suddenly they're like, oh, wish I had learned this sooner because I can switch now, but
Mm-hmm.
it's a pain in the butt. And, so even things like that, it's nice to kind of get them earlier in the process so they can make those changes and plans.
That makes a lot of sense. So you said 20 to 25.
Yes.
Okay. I'm going to imprint that in my brain so I know when to tell patients. We have this postpartum resource guide that we give patients usually in the third trimester, but I'm going to give it sooner.
Okay.
So
Yeah.
some patients are eager beavers and they're like, I
Yeah.
graduated. Can I have that? Can I have that information now? So sometimes we're giving it out earlier, but oftentimes I think we kind of forget because we're still, in like the thick of treatment. And so it might come a little bit later, but now I know. So thank you for answering that. That's very helpful. And it makes a lot of sense in terms of the hypnosis aspect of it. And I'll have to say, I sat in one of your pregnancy circles and I think you were giving a guided meditation or a hypnosis, and it was
Mm-hmm.
amazing. And I'm assuming that the recordings are all your voice. Is that
Yes.
correct? Ah,
Yeah, yeah. So I loved our old recordings from the original creator because she's this sweet old grandma. She's got like the most soothing voice, but it's nice to have my own recordings as well because, I do the class with everybody and we do hypnosis sessions in class. So they're like, I want to hear your voice.
right,
So
right.
there you go.
Well,
It is
because
a
then
little
they,
weird though.
well, I have to say, most of my patients that we co-treat say they're very relaxed listening to you, and they really enjoy your voice. So you're doing a great job, Nicole. And I personally have
Thank you.
witnessed it as well, and I think I fell asleep during your session. So.
Great.
Yes. So I have so many questions for you, and I know you've answered a lot of this already about your practice passion, but is there anything else that you wanted to share about your practice passion?
Um, practice passion. I mean, I feel like I've covered most of it, probably. Like I said, I'm kind of in it for the babies and the families together, making sure everybody kind of comes out unscathed. I Yeah, I don't know. I'm hoping to kind of expand offerings in the future. We'll see when that comes to fruition. But I would really like to have a physical space where we have more support circles of all different kinds. I have run peaceful pregnancy circles, which you've attended in the past. And I would like to continue those and do maybe like postpartum support circles. I would also really be interested in starting like fertility support circles or like a series, as well as movement classes. So yoga, Pilates, even just like, I don't know, gentle stretching, just, I don't know, whatever we need in this time frame. Because I think a lot of it is also about finding community. I think something people ask me about a lot is, well, I'm pregnant. I don't really like want to connect with other people who are having babies, but I don't know where to find them.
Right, right.
So, ways to create more of that community is something I'm interested in doing more. Just have to get there practically.
Well, this all sounds wonderful, and I am more than happy to collaborate with you on any of it. And, the fertility circle as well. That's definitely something that
Yeah.
would be part of my practice passion as well.
Yes.
So, okay, one last question for you, Nicolle. Thank you so much for answering all of my questions. I felt like I had a lot to ask today. And a lot of this comes from common questions that I get from my patients.
Mm.
And I'm usually like, I'm not sure. Here's Nicolle's card. But now I know, and I can give them a little more informed information before I send them your way. What advice do you have for new moms or expecting moms?
Mm. So, to listen to your intuition above all else. I feel like even when people are trying to have a baby, and when they're pregnant, and then when you're a new parent, there's so much noise. There's so much conflicting information, whether that's from your mom or your friends or social media or Facebook groups or different articles, even online. And it's really hard to figure out the right decisions to make that are going to be best for your baby. You want to listen to all these different, quote unquote experts, but the experts can't even agree. So it's hard. It's hard, and it can contribute to a lot of insecurity and doubt. But I firmly believe that if you can quiet that noise and listen to your own intuition, because nobody knows your baby better than you do. No expert. And for everything one expert says, there's going to be a different one that's going to say what you would want to do anyway. So it's probably fine. And that's the best thing that you can do. On the other hand, I would say it is also good to keep an open mind. I think having like a rigid thought process about what parenting a baby can look like is not helpful. I think sometimes as new parents, we get stuck into, oh, well, it has to look this way, even if that's not necessarily working for us. We had a vision of how life would be with a baby, and you're like, oh, wait, this person has other plans for me. So just being open to changing your mind about how you want to do things. So that was just something that really helped me get through some of those early months and years, was saying, you know what, it's okay that I don't want to do it this way anymore. I'm just going to change my mind. So yeah, those two things.
I love that. That's perfect advice. Now, for the moms that are coming up for delivery or newly pregnant, do you have any books that you suggest? Anything they can listen to on Audible?
Oh my gosh, there's so many books
to prepare them.
Um,
Maybe just one or two of your favorites.
I mean, I'm always a big fan of the Hypnobirthing book by Marie Mongan. I also tend to recommend Gentle Birth, Gentle Mothering by Sarah Buckley. I feel like that's a great marriage of intuition and the sacredness of pregnancy and birth with science, because it's written by an Australian obstetrician who really has a great understanding of hormonal physiology. And so the way she explains all of that together, I think just makes a lot of sense and soothes, I guess, people like me who I'm all about, the energetic, spiritual side of things, the like hippie woo side. But I love research. I love to know, like, what does the current evidence say, and how does body work, and how do these pieces fit together? So it's kind of a perfect balance of that.
I love that. I think we're very similar in that way. I love all the relaxing, all the like intuitive tools that we have, but I also like the science too.
Yeah.
And I think they can coexist, right?
Yes.
And we
absolutely
could be informed in both ways. So, Nicolle, what is your next upcoming hypnobirthing series that's coming up? Or are you in one currently?
I just started one, and then I'll be taking July and August off for, summer with my kids, but I'll probably have another one starting up in the fall in September.
Okay, perfect. And what's the best way for guests to sign up for your classes? Would it be through your website or through Instagram?
Yep. So I have all the information on my website. They can sign up right online. If anybody has like doubts about hypnobirthing as a method, I also have a free workshop online that they can sign up for. It's just like a 30-minute video of me kind of going through more in depth the different parts of hypnobirthing, as well as a bunch of other like free goodies. I have video testimonials from past students. I forget what it's even in there, but there's just a ton of stuff. It's kind of like a preview of the class. And if anybody is still on the fence, I would love to just get on the phone and have a conversation. I feel like I'm a pretty honest person, and I will kind of be blunt about, the different options available and the pros and cons of the different ones. I'm not here to just try to sell everybody that my way is the best way. I want people to find their own way as the best way. So yeah, just reaching out through my website. I'm on Instagram a lot too, so that's another good way to get in touch with me.
Okay, that's awesome. I will list all of your information, all your handles and everything, your website in the show notes. So thank you again so much, Nicolle, for being a guest on my podcast. And again, I'm so excited about what you offer and the new things that you have coming up soon in the near future. And I can't wait to see your new space as well.
Yeah.
When that's all ironed out and you find the perfect place that you're meant to be at. So,
Yes.
all right, Nicolle, thank you again.
Thank you so much.